Hello and welcome to Digital Medboard. Here we go. We are examining the right inguinal region. The inferior epigastric vessels arise from the external iliac vessels and continue as the femoral vessels. In the right thigh, they are referred to as the femoral vessels, while in the pelvis, they are known as the external iliac vessels. As they pass under the inguinal ligament, they become the femoral vessels. If the hernia is lateral to the inferior epigastric vessels, it originates from the deep inguinal ring and is classified as an indirect inguinal hernia. If the hernia is medial to the inferior epigastric vessels, it is classified as a direct inguinal hernia, which occurs in Hasselbalch triangle. The boundaries of Hasselbalch triangles are inferior epigastric vessels, inguinal ligament, lateral border of the rectus sheath, enclosing the rectus abdominis muscle. A hernia occurring medial to the inferior epigastric vessels is more common in elderly patients and may involve the urinary bladder weakness. This is a direct inguinal hernia causes vesicocele, which occurs due to weakness in the conjoint tendon. The inguinal ligament attaches at 2 points: anterior superior iliac spine and pubic tubercle. We got a question. Hernia lying medial to inferior epigastric artery and superior to pubic tubercle occurs due to weakness in. Based on our discussion, if the hernia is medial to inferior epigastric vessels, it is classified as a direct inguinal hernia, which occurs due to weakness in the conjoint tendon. Therefore, option C is the correct answer. If you found this video helpful, don't forget to like, share, and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose